Thanks for joining us. Over the last month, we've been seeing an increase in COVID cases among kids, with the variant spreading, and those numbers have had doctors worried.
But even though the numbers are going in the right direction now, Amanda Quintana has more on why we shouldn't let our guard down just yet. Amanda?
Yeah, if you take a look at statewide and Dane County data, it shows that cases among high schoolers and middle schoolers are decreasing. Of course, that is good news, but without a vaccine, those kids under 16 will still be vulnerable to the virus.
A parent, a grandparent, a teacher, an older sibling, if all those people are vaccinated, that's protecting that younger person in that family or in that community from getting COVID.
The more people in Wisconsin get vaccinated, the less opportunity for the virus to infect a kid. Now more vaccinated teens are making a big difference.
We've seen a really great vaccine uptake among 16 to 17-year-olds. On the 7th of April, we had 15% coverage among 16 and 17-year-olds, and now we're at 57%.
And it's paying off with a noticeable decrease in cases among kids in the last 2 weeks. When Dane County started to see that increase in mid-April, the 7-day average in cases among kids 12 to 17 was about 10, still much smaller than the big peak we saw in the fall when it was about 30. Today, it's less than 5, and even smaller among younger kids. We're seeing the same trend statewide. 2 weeks ago, nearly 430 kids, 14 to 17, were diagnosed with COVID. Preliminary data for last week shows 272 new cases in that same age range.
Well, at least in Wisconsin, we're seeing improvements. I mean, we're still seeing rising cases in some areas of the country. And so I think we need to take all of this with a grain of salt.
Dr. James Conway says although those numbers look good, they're mainly a reflection of how low virus circulation is in Wisconsin as a whole. A different story in states like Minnesota and Michigan.
In the states that are doing poorly in controlling their ongoing outbreaks, those states also have a lot more pediatric cases.
Over the last few weeks, kids made up more than 20% of new cases because without vaccines, they're still left vulnerable, something for parents to keep in mind this summer.
We've seen a little bit of activity with indoor sports and COVID, so just thinking about the activities your kid is involved in and ways to lower the risk among those.
The theory is that really young kids, like those under 5, don't transmit the virus as much because their sneezes and coughs aren't as powerful to spread the virus. But Dr. Conway says that for those 12 to 15-year-olds, it'll be a really big deal for us to get them vaccinated because they are a very social group outside of school.